Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mechanism of action. CNS. In the CNS, in the brain, frontal lobe causes euphoria. Effect on on occipital lobe. Occipital lobe, alcohol effect on occipital lobe causes visual disturbances. Alcohol effect on cerebellum causes incoordination, cerebellar incoordination. Midbrain. On midbrain, alcohol activates the reticular activating system. Reticular activating system is the primary target of alcohol. This will activate the thalamus and spinal cord and medulla, and finally it will depress the respiratory center, leading to the death. In GIT, if moderate amounts of alcohol are consumed in the GIT, this moderate amount of alcohol which is consumed will increase the salivation, it increases the gastric juice and increases the appetite. This is called as carninative action. In the renal, the alcohol inhibits ADH or antidiuretic hormone, and thus it causes diuresis. In the skin, it causes vasodilatation, and thus alcohol results in false sense of warmth in the skin, and it increases the heat loss, diaphoresis, and thus increases the sweating. Fatal dose of alcohol is 150 to 250 milliliters of absolute alcohol is the fatal dose. It is fatal period is around 12 to 24 hours. Signs and symptoms. There is stage of excitement is seen.
thank you and thank you for watching.